Welcome back to BNC Live. The CDC says that more than 107,000 Americans died from drug overdoses last year, and that sets another tragic record in the country's overdose epidemic. But there are efforts happening across the country to help people get sober. Here's my conversation with the executive director of Savage Sisters out of Philadelphia. Joining me now is Sarah Laurel, founder and executive director of Savage Sisters. Sarah, thank you so much for being with us today. Your own story was your inspiration for starting Savage Sisters. Tell us about your personal journey in recovery.
Yes, thank you so much for having me. I was a corporate executive. I was given a prescription for opioids, and that led me down a very difficult path. I spent several years in active use. The last 3 years I was homeless in Kensington and addicted to substances. I experienced a very traumatic physical injury, and I was in a wheelchair. So when I actually got sober at that time, I wanted to create a safe space for women to recreate their lives. And that kind of started everything.
So tell us about Savage Sisters. How did you come up with the name of this organization? And more specifically, how did it come about?
When I was thrown out of a second-story window in Kensington, I was wearing a dress that said Savage across the chest in gold, bold letters. And when I was in the intensive care unit for several days, I kept seeing the word. And I had some memory issues, so I continuously would Google the definition of the word savage because it was the only thing I could see from my hospital bed. And the word ferocious stuck out. So when in my wheelchair, when I got to the original Savage House, I decided I was going to turn it into a safe place for women. And when I was choosing a name for it, I chose Savage Sisters because the way that I chased drugs ferociously, I wanted to apply that same energy to ferociously chasing recovery and healing.
I love how you took a horrific experience and then just flipped it and used the word and your personal journey to change the lives of others.
All of our residents receive free trauma therapy from private practitioners, kickboxing once a week, and in-house yoga weekly, in addition to a myriad of other modalities of healing. We try to empower our residents to choose how they want to heal and offer them autonomy in their journeys.
That's extraordinary that the services that you offer are free, because financial issues can often be a barrier in people getting the real help that they need. And you describe your program as whole health oriented. What exactly does that mean?
Yeah, so we want to offer resources for our residents that encompass every level of healing. When a majority of the individuals that we serve are coming in with absolutely nothing, so they don't have access to a lot of different opportunities for healing. So we wanted to attack the mind, the spiritual, and the physical. So we have a nutritional specialist that helps with healing in a physical way and seeing food as a modality of healing. And we wanted to offer them something that was physically helpful, which is the kickboxing. The yoga is good for spirituality and mindfulness and tapping into the divine within. And then the therapy is crucial towards recovering from the traumatic experiences that they've had. So we encompass all of the things that a human being experiences when they are in active addiction or homelessness or have substance use disorder.
So it's really just a holistic methodology, mind, body, and soul. I think that's so important. The housing that you offer, that's basically a safe haven for the clients. So what training does your team have to make sure that they are providing a real safe zone for people who are really struggling?
So I would say the most important thing that we offer is a full team of humans with lived experience. We are uniquely qualified to meet those individuals where they're at in a day-to-day way. The individuals that offer the trauma therapy, they're all licensed clinical social workers and trauma therapists. And nutritional therapists and things like that. They have all the qualifications needed. But I have stuck to my gut and only brought people onto our team that have lived experience. And I think that that speaks volumes because we're able to relate to human beings and understand the difficulties and the challenges and barriers they have to overcome.
And unless you've lived that, you really can't relate. You really can't understand what someone might be going through. I want to talk to you about this new CDC report because it shows that more than 107,000 Americans died from drug overdoses last year. The numbers don't seem to be getting better. They seem to be getting worse. So in your opinion, where are we as a country going wrong? What needs to be done?
In my opinion, I think that we are isolating specific substances and demonizing them. I don't call this an opioid epidemic. I believe that this is a public health crisis. The more they schedule particular substances, first it was the opioid epidemic and prescription medications went down. We saw a rise in heroin. When we started, really tightening down on the heroin influx, we saw fentanyl hit the streets, which is incredibly deadly. So I think that overall, we need to address this in a public health manner and offer resources to individuals who use drugs and different substances. I think that we've not really addressed the idea of problematic drinking. Over 98,000 people died from alcohol-related deaths as well. So this substance issue in our country, we need to begin reaching people who are actively using and might not be ready to get sober and allow them to be autonomous in their healing journey, remove the stigma from it, and create connection to those people. Because the system that we have right now is the only time there are resources is when they are ready to go to treatment. And the reason people are dying is because they're not ready yet, and they're using in an unsafe way. The supply is not safe at all. And we're not talking about the drug use, and we're not talking about ways to reduce harm as a community.
If someone is seeing this right now and struggling, what's your message to them?
Reach out. You don't have to be sober to get loved and to have resources. You can create a safer environment for yourself while you're in that journey. And when you're ready to reach out for help, enter into an acute withdrawal treatment facility, we're here for you, and we're here for you before that as well. There are Never Use Alone hotlines, and there are millions of Americans that will walk with you through that darkness until you're ready to get sober. And once you get sober, there's so many people out there that can carry you through that journey.
Just beautiful to hear. If someone would like to donate or learn more about your program, where can they go to find more information?
You can go to savagesisters.org. There's a Give Today button. There's also sponsorship opportunities to be a continued donor. And we have a Amazon wish list with a majority of our medical supplies for our street-based wound care that we offer. So there's a ton of ways to get involved, volunteer, donate, become a sponsor, and stay savage.
Sarah Laurel, thank you so much for joining us and for the extraordinary transformative work that you are doing.